Hello and welcome. My name is Dr. David Moore and this is Health Talk. And this is the show that tries to bring into your living room information and education on how to take care of your health. In a world of extended lifespans and the healthcare hierarchy of the 100-Year Lifestyle, a book that we've highlighted on the show in the past and which I use as a text in our office, we talk about self-care, healthcare, and crisis care, as opposed to the old model where it's just sick care, crisis care, and you go to the doctor. So self-care are things that you can do things you can do for yourself to take care of your health. Where health care is the things that you can't do for yourself, in which you need a health care provider or professional to help you with. And so on our show, we like to have, we try to bring in some from the community, some of the best professionals that are available to us that can help us with our health care. And tonight, our guest is Dr. Vita of the Pain Relief Center in Clifton. Many of you probably already know him if you're from Clifton. He is one of the premier dentists, as well as he does a lot of work with TMJ, and that's how I came to know you, Dr. Vita, and welcome to the show. So how this could affect the quality of somebody's life?
Typical symptoms, of course, include headaches, which are really around the temporal region, facial pain, inability to chew, even dental-related pain. But the biggest impact on the quality of life has to do with sleep. When you have this kind of dysfunction, as well as a cervical dysfunction, they do go hand in hand, and the patient's sleep is really disturbed. And of course we know how it affects the chemistry with the serotonin and tryptophan levels in the brain. And that affects their mood, and that affects their ability to function, to cope. Okay, so besides the obvious, which is pain, patients wake up with headaches, they function throughout the day with a headache, they can't eat, they can't chew, they have facial muscle pain, they have a true disturbance in their sleep patterns, and I do believe that has a great impact on their overall quality of life. And then typically a patient will say, well, I grind my teeth because I'm under stress or nervous, but that's really not true.
Okay.
Patients grind their teeth or brush their teeth as a manifestation of the problem. It's not the problem itself. Typically, we do treat bruxism with different mouth guards and so forth, but that is
manifestation
not
of
a problem, a dysfunction, a structural dysfunction, either within the joint, within the cervical spine, within the musculature, within the coordination and the hyperactivity of the muscles themselves.
Yeah, I find sleep posture, and people always think that, I think it's the way that I sleep. And the reality is your body finds a comfortable position. It's adapting to its contractures and compensation. So really when you sleep, you're finding you're actually falling into the pattern that your body is most comfortable in. If you actually, these muscles are contracting, if you're stretching out a muscle that wants to be contracted, you probably won't fall asleep until no matter how hard you try. So there's definitely a mechanical aspect of that.
That has a greater mechanical impact on the cervical spine than the TMJ, but indirectly on the TMJ, because, for example, if a patient were to fall asleep on the couch in a twisted kind of position, okay, then of course there's a compression of the cervical nerves, right, and then that has an impact on the trigeminal system.
Sure.
All right, so indirectly, patients come to us often with facial pain, facial muscle pain, with a primary cervicogenic origin.
Right.
And that's very, very common. And that's why it's so important to at least understand the two systems and know that we cannot treat one without the other appropriately.
In being in practice for as long as you have, and we do want to talk about how it affects lifestyle, how it affects people's lives. So if you don't mind, and we're talking a lot about the clinical aspect of things, but if you have maybe a story or somebody that sticks in your mind that you came in and I know you're a very humble person, so you're not here to toot your own horn, but I think it's important for people to know that it could be, to some of these people, it's life-changing.
Yeah. You know, the biggest thrill we have in our profession is when you're able to help a patient, especially a patient that's been suffering for so many years. You know, so any little thing that you can do, even if it's just to lead them in the right direction, say, hey, this is not a TMJ or cervical issue, but perhaps you should see this medical specialist or that medical specialist. You know, that's our obligation to our community, and every day that we wake up, that is our obligation to every patient that sits in our chair. So the stories are endless. Every patient that comes into our chair and gives us their full faith, has faith in us, we have an obligation to them to be the best we can be. And even if it's a simple filling, if it's a simple adjustment, if it's a pat on the back, or if it's a life-changing treatment or therapy, because we know they were going downhill, and how much medication can a person really take, having all the side effects of medication like that. So if we can actually pinpoint what their dysfunction is and provide whatever care, and I think that patients really trust us because we know that we really care. It's all about care. And if I can't help them, I will find the person that can. And sometimes I stay up nights, sometimes we do a lot of reading and a lot of investigating, and our patients do prey on our minds, especially when we cannot help them, or we have to find the answer for these patients because they're very, very desperate.
For Health Talk and for myself, thank you for being on the show today.
Thank you
and
for
we
inviting
can't wait
me.
to have you back.
My pleasure.
Great.
Thank you. All right.